What are the important findings on this chest X-ray PA view? X-ray chest taken after mitral valve replacement. RAE, right atrial enlargement, seen as shift of right heart border to the right. LAE, left atrial enlargement noted by the double density. These findings were probably present prior to mitral valve replacement. Mitral valve prosthetic ring and struts are seen near the left border of spine. Tilting disc of this prosthesis is not radio-opaque. Straightening of left heart border due to left atrial enlargement and post-operative sternal fixation wires are the other findings. Prominent upper lobe vessels, also known as cephalization, antler sign and inverted moustache sign, indicate pulmonary venous hypertension. Widening of carinal angle is another indication of left atrial enlargement.